In 2014, a U.S. National Comorbidity Survey compared EMDR, eye movement desensitization and reprocessing, with CBT, cognitive behavioral therapy, regarding depression relapse rates, and found that the CBT relapse rate was 50 to 80% for depression versus EMDR being 0%. Then 2 years later, Yasmin Gouar compared EMDR with CBT and medication, which is the CBT medication being the most common therapy approach in North America. Anyway, she found that CBT had a 40 to 50% effectiveness rating for depression with CBT and medication versus EMDR, which had a 95% effectiveness rating for treating depression. So those are very important statistics. If somebody's struggling with depression, CBT requires a lot of homework on behalf of the client, and EMDR requires zero homework on behalf of the client. Most people tend not to do the homework. That's one of the biggest complaints from CBT therapists, is that clients don't do the homework that they're given. And that makes a lot of sense, because if you go into your stressful environment and you're in fight, flight, freeze, or something like that, high stress, you're less likely to be able to respond in a different way, because our patterns are hardwired into our brain based on traumas from the past and the way that our brain discovered how to adapt and survive through those situations. So it's very unlikely that people will end up doing their homework when they're in those stressful states, because they don't have a whole lot of access to the prefrontal cortex during high stress states. As an EMDR, certified EMDR therapist and approved EMDR consultant by the EMDR International Association, I have to say I am quite biased towards EMDR's effectiveness, as I've seen it work time and time again.